All right, so get ready because today we're diving deep into AI in healthcare.
Sounds exciting.
It is, you guys sent in some fascinating articles about how AI is totally changing the game.
Oh, absolutely.
Diagnosing diseases, even creating new drugs,
Yeah, and even performing surgeries. It's amazing.
all with the help of AI.
It's incredible how quickly AI is going from like this futuristic idea to a tool we're using right now.
Right, exactly. It's not sci-fi anymore.
It's making a real difference in healthcare today.
So one thing that really stood out to me was AI as a medical detective,
Yeah.
like analyzing medical images, like X-rays, MRIs,
Yeah.
and it can be like more accurate than humans in some cases.
And that's because these AI systems are trained on huge amounts of data.
Right.
So they can see these really subtle patterns and issues that even really experienced doctors might miss.
Wow.
It's like having a second pair of eyes, but these eyes have seen millions of other images.
And it can instantly compare.
Yeah.
So it's not just theoretical. This is happening now.
This is happening right now.
Huh.
Like Google's DeepMind,
Hmm.
they have an AI system that can diagnose over 50 eye diseases just by looking at retinal scans. Just from that.
Oh.
And think about what that means for early detection and treatment, especially in areas where you might not have as many specialists.
Yeah.
Right.
It's like having a world-class ophthalmologist
Oh,
in your pocket,
exactly.
giving you an instant diagnosis.
And early detection is key for so many conditions.
Oh, absolutely.
And AI is becoming like really important in that area.
Yeah.
And it's not just eyes. AI can detect like everything from cancers to Alzheimer's to heart disease, often at stages where there aren't even any noticeable symptoms yet.
Wow. That's a total game changer.
Right.
Because the earlier you catch something,
Yeah,
the better the chances of successful treatment.
absolutely.
It's almost like having a silent guardian watching over your health,
Yeah.
constantly looking for any trouble.
Yeah. And a striking example is like the COVID-19 vaccines.
Right.
Researchers used AI to study the structure of the virus
Okay.
and pinpoint the potential targets for those vaccines, which really helped speed things up.
Yeah, instead of years and years of research,
Yeah,
AI shaved off all this time in developing the vaccines,
exactly.
which ultimately saved so many lives.
Exactly. And AI is revolutionizing drug development in general,
Right.
because traditionally it's been a really long and expensive process, but AI is changing that.
How?
It analyzes these massive data sets and runs simulations to predict which compounds will work best against certain diseases.
Okay, so instead of spending years and billions of dollars on research,
Yeah.
AI can help focus on the most promising options from the start.
Right from the beginning. And it's not just about speed. AI is paving the way for what's called personalized medicine.
Oh, I've heard about that.
Yeah.
What is it?
It tailors treatments to your unique genetic makeup.
So no more one size fits all. So it's about finding the right treatment based on your own individual needs and makeup.
Exactly. For instance, IBM has this thing called Watson for Oncology,
Okay.
and it analyzes a patient's medical records, their genetic information, all the latest research, and then it recommends the most effective cancer treatment plan.
So that's like having a supercomputer working with your doctor to figure out what's best for you.
Exactly. And this personalized approach means better treatment with fewer side effects.
And it's not just stopping there. AI is showing up in the operating room.
Oh, yeah, AI-powered robots.
Yeah, assisting surgeons with this incredible precision,
It's amazing.
making surgeries safer and less invasive.
I read about the Da Vinci surgical system. Have you heard about that?
Yeah, it sounds so futuristic, but it's being used right now.
It is. It is. The Da Vinci system lets surgeons operate through tiny incisions using these robotic arms, which the surgeon controls,
Wow.
and AI guides those robots, smooth, precise movements, even making adjustments in real time.
So it's almost like having a surgeon with superhuman hands,
Yeah.
guided by the knowledge of countless other surgeons. That's incredible.
And this means faster recovery times,
Mm.
fewer complications for the patients.
So we've got AI acting as a medical detective, speeding up drug development,
Mm.
personalizing treatments, and even assisting in surgeries.
And we've only just scratched the surface.
It's mind-boggling.
It is. And as AI continues to evolve, we can expect even more applications
Yeah.
and more transformative changes in how healthcare is delivered.
It makes me think about the whole world of mental health care.
Oh, yeah.
We touched on AI chatbots earlier,
Yeah.
but how are they actually changing the landscape of mental health support?
Well, they're becoming more and more sophisticated all the time,
Okay.
using something called natural language processing to have conversations that actually feel natural and empathetic.
Oh, wow. So they're more than just like automated responses. It's like actually talking to an AI
Yeah, it is.
that understands your concerns.
Exactly. And they can offer support, suggest coping mechanisms, even recommend stuff like breathing exercises or mindfulness practices.
Wow.
So it's almost like having this like virtual therapist available all the time.
It's 24/7.
Yeah, which is like super valuable if you don't have easy access to regular therapy.
Yeah, especially with, the demand for mental health services increasing
Yeah,
and limited access to care in a lot of places.
absolutely.
Yeah.
Especially for people who might feel uncomfortable actually going to therapy, right?
Yeah, of course.
A chatbot can be a much more private and less intimidating way to get support.
For sure.
So it's like a first line of support.
Yeah.
And if the chatbot senses you need more intensive care, it could actually connect you with a real therapist.
Like a triage system for mental health care.
Exactly.
It's amazing.
And what's really cool is that AI isn't just providing therapy, it's helping us understand mental health better. By analyzing all this data, AI can identify patterns and trends that could lead to more effective treatments and even prevention strategies for these mental illnesses.
Wow.
So we've been talking a lot about how AI is improving patient care, right?
Right.
But it's also changing how healthcare professionals actually do their jobs behind the scenes.
How so?
One area we see this is in administrative tasks. AI is streamlining things like billing and documentation,
Oh, okay.
which frees up doctors and nurses to actually spend more time with their patients.
That's great for both the patients and the healthcare provider.
Yeah. Imagine a doctor dictating notes after seeing a patient. AI tools can convert that speech to text instantly.
Wow.
It saves so much time.
It's like a super efficient medical scribe,
Yeah.
ready to document everything.
And AI can do much more than transcribe.
Oh, yeah. Like what?
It can help schedule appointments, manage records, even code medical bills, which can be really complicated and time-consuming.
So it's basically taking care of all those tedious tasks that bog down healthcare professionals,
Exactly.
which could be a huge relief for doctors and nurses who are already so busy.
It can potentially reduce burnout,
Yeah.
improve job satisfaction,
Right.
and that ultimately leads to better care for patients.
We've just begun our deep dive, but it's clear AI is transforming healthcare in so many ways.
Absolutely. And we've got so much more to explore.
So stay tuned for part 2, where we'll go even deeper into this amazing world of AI in healthcare.
It's going to be good.
Whoa.
Welcome back to our deep dive into AI and healthcare. We covered so much ground already.
I know, right? But there's still more to uncover, isn't there?
So much more. We've been talking about how AI is changing things for patients,
Yeah.
but let's look at how it's changing the way healthcare professionals work.
Okay. Yeah, it's easy to get caught up in, the patient experience.
Exactly.
But the way doctors and nurses do their jobs, that's changing too, right?
Absolutely.
Yeah.
And one area where AI is making a big impact is medical imaging. AI algorithms can now analyze all those X-rays, MRIs, CT scans super fast and incredibly accurately.
Wow.
They're actually sometimes even better than human radiologists at some things.
Wait, so does that mean radiologists are going to be out of a job?
No, not at all. Think of it as like a collaboration.
Okay.
AI is a tool,
Yeah.
right? And it actually helps radiologists do their jobs even better.
Okay, got it.
Like it's like having a second set of eyes, but these eyes have been trained on literally millions of images.
Yeah.
And they pick up on these tiny details that humans might miss.
Wow.
So it's more like it frees up radiologists to focus on the really tough cases
Right.
and spend more time actually talking with their patients.
Yeah, that makes sense.
And it's not just radiologists who are benefiting. Pathologists, cardiologists, oncologists, every specialty is finding ways to use AI.
Wow. It's amazing how quickly AI is becoming a normal part of medicine.
It really is.
Yeah.
And, it's not just about better diagnosis and treatment.
Okay.
AI is actually streamlining research and drug development, too.
We touched on this a bit before, but it's like changing how quickly medical discoveries are happening.
Right. Like fast-forwarding the process.
Yeah.
So we can have new treatments and maybe even cures way faster.
It's kind of mind-blowing.
It is. But we have to remember, AI is a tool.
Right.
And like any tool, it has to be used the right way.
Responsibly.
Exactly. We've talked about the ethical side, making sure the algorithms are fair,
Yeah.
protecting patient privacy, that kind of thing.
That's so important. As AI becomes a bigger part of healthcare.
It's all about finding the right balance,
Yeah.
encouraging innovation, but also making sure AI is used ethically.
For good.
Exactly. So as we're wrapping up this deep dive, what's the one big takeaway for listeners?
That's a good question. What is it?
AI is here now, and it's changing healthcare in huge ways.
Yeah.
From figuring out what's wrong with us to creating new treatments, even helping surgeons, and making all that paperwork easier.
Right. It's already making a difference.
It is, and as it keeps evolving, we'll see even more amazing things in the future.
It's been fascinating learning about all this with you.
It really has. And the most important thing is we got to approach AI with excitement, but also be careful.
I like that. Be excited, but be cautious.
We need to make sure it's always used ethically and responsibly.
Putting patients first, always.
Always. And if we can do that, the future of AI in healthcare is incredibly bright.
It's definitely a lot to think about. Thank you for joining us on this deep dive into the world of AI and healthcare. We hope you learned something new.
And we'll see you in the next one.
Welcome back for the final part of our deep dive into AI in healthcare.
Yeah, it's been quite a journey, hasn't it?
It really has. So we've talked a lot about how AI is changing things for patients.
We have. But what about the doctors and nurses themselves?
Yeah, how is AI changing the way they work?
Well, one area where it's having a huge impact is in medical imaging.
Oh, interesting.
You know, those AI algorithms. They can analyze X-rays, MRIs, even CT scans.
Right.
Super fast and with amazing accuracy.
So is this like replacing radiologists then?
Not at all. It's more about working together.
Okay.
Think of AI as this super powerful tool that actually helps radiologists do their jobs even better.
Got it.
It's like a second pair of eyes. Right?
I like that analogy.
But these eyes have seen millions of images,
Wow.
so they can spot things a human might miss.
That's incredible.
And it frees up radiologists to, spend more time with patients.
Yeah, makes sense.
And it's not just radiologists. Pathologists, cardiologists, oncologists, all kinds of specialists.
Wow.
They're all finding ways to use AI in their work.
AI is becoming a normal part of medicine, isn't it?
It really is.
Hmm.
And it's not just about diagnosis and treatment either.
Oh, what else?
AI is also changing research and drug development.
We talked about that a bit, yeah.
Right, but think about it. It's like speeding up the whole process of medical discovery.
Yeah, like fast forwarding it.
Exactly.
So we can get new treatments, maybe even cures, so much faster.
And that has the potential to save countless lives.
It's really incredible.
But we can't forget, AI is a tool.
Right.
And like any tool, it has to be used responsibly.
We've talked about the ethical considerations, right?
We have. Making sure those algorithms are fair, protecting patient privacy, all of that is super important as AI gets more ingrained in healthcare.
So as we wrap up this deep dive, what's the one big thing you want listeners to remember?
That AI isn't just some futuristic fantasy. It's here, it's now, and it's already changing healthcare in huge, huge ways.
Yeah.
From diagnosing diseases to coming up with new treatments, even helping surgeons and making all that paperwork easier.
It's already making a difference.
It is. And as AI keeps getting better, we're going to see even more amazing things.
It really makes you think, huh?
It does. The important thing is to approach AI with both excitement and caution.
I like that. Excitement and caution.
Embrace the possibilities, but always remember the challenges.
Yeah, we need to make sure it's always used ethically or responsibly, with patients always coming first.
Exactly. And if we can do that, the future of AI in healthcare is incredibly bright.
Well, it's definitely been a fascinating journey exploring all this with you. I feel like I have learned so much.
It has been fun.
It has. Thank you to everyone for joining us on this deep dive into the world of AI in healthcare. We hope you enjoyed it.
And we'll see you next time.